The majority of men with metastatic germ cell tumors are cured with first-line platinum-based chemotherapy. About 20 to 30% of patients will have resistant or refractory disease, and the prognosis is significantly more guarded for this group of patients. The purpose of our study was to perform deep sequencing of tumor tissue from this group of patients and see if we could identify actionable or driver mutations with the idea of potentially providing a novel individualized treatment therapeutic. Our entire group of patients had 120 samples. 76 of these were from patients with resistant disease. So we performed whole exome sequencing on 19 of the samples, and we performed MSK impact sequencing, which is an exon capture-based technology where DNA is extracted from the tumor and matching normal. Libraries are created, then it gets probed for 341 cancer-associated genes. They undergo deep sequencing at a coverage of about 500 to 1,000x, and then we receive data regarding somatic mutations, copy number changes, insertions, deletions, and structural rearrangements. We did. We ultimately found targets in about 50% of the patients. The most common of these were MDM2 amplifications in about 9% of the group. MDM2 is a ubiquitinase that functionally inactivates p53 through ubiquitination, direct transcriptional inhibition, and nuclear export. We also found MYC-N amplifications in 5% of the cohort. MYC-N transcriptionally targets both p53 and MDM2. It's also associated with poor prognosis in neuroblastoma, but encouragingly, it does confer sensitivity to MDM2 inhibitors. We found KIT mutations in 5% of the population. Most of these were exon 17 mutations. This is different from gastrointestinal stromal tumors, where most of the mutations are found on exon 11. And there's actually been a negative study of imatinib in patients with refractory germ cell tumors that were selected based on immunohistochemistry. Our data suggests that the deep sequencing provides further information, further granularity, and these patients could be tailored towards exon 17 inhibitors or second-line TKIs. That's right, and most of the findings that we observed have been either determined to have clinical benefit in other cancer types or in the preclinical setting. So there is some further early stage and investigational work that's required. But yes, most of these targets that we identified, there are currently existing drugs. Yeah, so part of the goal of this study was to actually identify mutations that were functionally characterized. These are well-characterized mutations that have biological activity and have drug targets available. So we were fairly conservative in reporting our results. We didn't report all mutations. We didn't report all even functionally characterized mutations, but focused on mutations that have biological activity and drug targets available.